it is 3 o'clock, and I would like to call the Mason County Board of Health regular meeting on September 28th at 3 p.m. to order. And I can't see all the people, but maybe you can.
Right, so I can just kind of go across. So
Right.
we have this, I'm here. We've got Dr. Stein here, Diane Zorn is here, Darren Moody, Kevin Schutte, Sharon Trask, Kathleen McDowell, Diedrich Allen, Randy Netherland, Lydia Buhite, Carrie Davidson, Mackenzie Smith, Alex Pacey, and Penny Van Buskirk. So the gang's all here.
Okay, we definitely have a quorum now. So I'd like a motion for the agenda.
So moved.
I'll second.
Any discussion? Hearing none. All those in favor?
Aye.
Aye. Okay, it passes. I'm assuming no one nayed, or I didn't ask, I guess. So any opposing? No? Carries. Okay, so can I get a motion for the minutes of July 2021?
So moved. This is Sharon.
I know. I can hear your voice and see you. Okay. Okay, it's been moved and seconded. Any discussion? Hearing none. All those in favor?
Aye.
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 Any opposed? Hearing none, it passes. And so we'll go to the health officer's report. Dan, you're mute. Yeah.
Hi all, it's good to see all of you. I'll be brief because I saw that I read through Dave's from the director discussion, and he's got an excellent presentation about the current state of COVID and all the other projects that we're working on in the health department. I just wanted to, I'll be planning to hand over the reins of the health officer position to a very qualified and passionate provider in Carrie Gardner. I've been working with her over the past month, and she's already been proving herself to be an excellent provider, and she's making herself apparent on the state scene and working with the school superintendents and with the other people involved with public health. And I'm really excited that she's going to be representing Mason. I just want to thank the board and the commissioners for the opportunity to work with Mason over the past several years. It's been a great opportunity, and it's wonderful that you guys have put your trust in me, and I think that Mason has been a great place to work in public health and be participating with all of you guys. So thank you, and I think you guys I'm leaving the county in very capable hands.
Thank you for your excellent work. Okay. Anybody else have anything for Dan?
I'd like to thank you, Dan. I know you were, new and thrown into the pandemic, and I remember all those initial meetings at the school, and I really appreciate you hanging in there with us, even remotely, and continuing to help our county and schools through this time.
Thank you, Carrie.
Thank you too, Dan.
Good to see you, Lydia. I'm going to miss you guys.
Yeah, Dr. Stein, just really appreciate everything over the past couple of years. And I would have, like many of the members on this board, I think we would have liked to have had a chance to work with you longer and on some different things. But you really provided a really steady presence to all of us during the pandemic, and wish you and your family all the best.
I appreciate that. And I will absolutely be available for any support that I can give in the future for Carrie and Mason County in general.
Thank you.
Yeah, Dan, I wanted to thank you real quick too. You did a great job. Our EOC meetings probably went better with you there because you stopped a lot of people from going crazy, me being one of them. So I just wanted to thank you, and take your dog on a hike. I'm sure you need it.
Thank you, Commissioner.
Okay. So we're off to the administrative report. Dave?
Okay, so before I get into the financial discussions, which are always important this time of year, I kind of wanted to go over the graphs that I put into the packets, and if you have your packets handy, just to really briefly run through them. So the first figure is our current case counts, and you'll see on the far right-hand side, obviously Delta, we spiked up, but different than the rest of the state. Instead of spiking up really high, we went up and then plateaued, and we've just kind of been bouncing along on this plateau for a month now. We are starting to see cases come down. We were bouncing along about 30, 34 cases a day, and we're down 20 or less per day, which, I mean, a year ago, that would have been just unheard of to have 20 cases per day, but it's a new dynamic now. Hope to see that come down as we get into about the 12th week of this. I had projected about a 12-week cycle for this. We'll see if that comes to be. Otherwise, I'll have to change my hypothesis based on new data.
Okay, Dave,
So,
now flash back to a year and a half ago when we were waiting to get our 20th case period.
right.
Yes.
Yeah, I used to call with every single case, call the commissioners, so wow, such a different world we're in now. Okay, so the next one down is our hospitalization counts. And you see we kind of spike and up and down. Where that becomes important for us is the availability of beds. So availability of beds is kind of the limiting factor on what we can do besides COVID, on optional things, surgeries, et cetera, that's part of the hospital's general everyday business that they're in. And with beds full with COVID now, not that full with Mason County, but the beds around us are full. So should we exceed our capacity here in Mason County, we don't have any place to ship people to because everybody's kind of in the same situation we're in. Our hospitalization counts are starting to come down now. I was just looking at them minutes ago. We have more beds available now than we've had for the past couple of weeks. So that's a positive trend. Next chart down is cases by age group, and excuse me, percent vaccinated by age group. I didn't do cases per age group this time. So you'll see that our oldest Mason County residents are our most vaccinated group, and just kind of goes downward as you go to the left from there. It's interesting to see that if you compare this with our current age groups who are infected, our highest infection rates, in fact, our highest hospitalization rates are the 39 to say 50-year-old group, followed by the 20 to 39 group. So it's our lower vaccinated folks that are in the hospital and seeing more cases or more infections. And then on the next page, I just picked one group, the 45 to 65 or 64 group, to just give a graphic representation of people who are in the hospital who are vaccinated versus those who are not vaccinated. So on that chart, you've got the three colors. At the bottom, you've got green. Those are the folks that are in the hospital who are vaccinated. This is statewide data on this one, folks. This is not in Mason County, but this is a state data. The next one up in the blue are those folks who have had one dose of the vaccine so they're only partially vaccinated. And then the red are the unvaccinated. So what we're seeing locally, and I talked to Dr. Gushie about this at Area Command on Monday, is that, more than 90% of our cases in the hospital, and I think he said all of our deaths recently have been unvaccinated. So we're definitely seeing a protection factor from the vaccine as far as not going into the hospital and avoiding death. So I thought that was important. I didn't put a lot of detail with those. It's kind of a snapshot of what we look at every Monday and Thursday at Area Command. So any questions on what's happening right now, COVID-wise, data-wise?
None from me.
Okay. Okay, so let's talk about.
Dave, can I ask a question? Because been asked this question in a number of different ways, and I just was wondering for you on the state level if you have any information on this, but is there going to be any measure of people that have had COVID and what that impact is for either the health of the community or, you know, how that measures out with, you know?
Actually, no, I just got state modeling report 39, and I can condense that and send it out. One of the things it does show is the amount of immunity, so total immunity based on those vaccinated and based on those who have had COVID and recovered. So putting the two things together, giving you a total community immunity, and I can get that out to the board.
That'd be great.
I would like that information if possible.
Okay, I put it in, yeah, I've got a whole presentation. I'll send that out. I'll just send you what I sent to Area Command on Monday, and it covers a lot of that.
Okay.
So, and not only about the immunity, but our projections going forward from here based on the immunity, and maybe I should talk about that for just a minute. So DOH has done they're forecasting in two ways. One is a modest increase and one is a moderate impact. So the modest impact would show us coming off the backside of Delta with a fairly steep drop and getting below an R naught or an infection rate of less than 1. So an R naught of 1 for each person that has COVID, they will infect another person. And the more you go above that, the more exponential it gets. So if you get to 2, an R naught of 2, each person infects another 2. That's a bad thing to be. Right now, we're bouncing back and forth across the 1 mark. So DOH said, well, we'll do 2 scenarios, one of a modest one that, like I said, would drop us down fairly sharply on the backside of this going into November, and then slowly inching up as we go into flu season and other things as we get into December, like we did last year. The moderate increase takes into account being above the R naught of 1, so like 1.4, 1.5, and projects what that would look like. And I will have that in that for you as well. There's a couple of really good graphic presentations on what those would look like, both for cases and for hospitalizations. So we're starting to get some good stuff out of DOH on that piece. One thing we are lacking, though, that we have tracked in the past is the ability to look at the difference between the number of tests and the positivity rate, because they're about 700,000 test results behind putting them into the system. They get the positives out right away, but the negatives they're not putting into the system fast enough to keep up with our demand for data. So the data does not look right, and they've pulled it off of the DOH website. So we don't have access to that right now.
And that also doesn't include the home tests, probably.
No, it doesn't include the home tests. So what we've asked them to do, if they have a positive test on the home, is to go get confirmatory with a PCR at either the hospital or at the hub there in Belfair. And that way it does get it into the system. And that way we do get a lab, and the lab will automatically come into the system, where a home kit, if they were just to call us, we would enter that stuff by hand.
Right. Okay.
Okay. All right. Well, let's talk money. Always one of my favorite things. I'm going to try to share my screen here and see if that works. And let's go over here. I'm not sure that worked. Can you guys see my screen?
Yes.
Okay, super. So Foundational Public Health Services, I've talked about this in the past. It's kind of been a passion of mine working for the last 11 years. We developed this concept of foundational public health services. So if you were to take all the things that public health was doing, say back in 2010, 2011, and you distilled those into what we actually have to do, that's where it came up with foundational public health. So in kind of broad terms, if it's something that we're required to do by law, obviously that's foundational. If it's something that we can do that nobody else gets paid to do, like epidemiology, that's foundational. And then if it's primarily population-based work, working upstream and things, that also would be foundational public health. So in a 10-second elevator speech, you could say that foundational public health are those things that you could accidentally bump into that would affect your health. Bad food, air, water, communicable disease. And then the more it becomes something you do to yourself, the less foundational it becomes. And then it becomes what we call additional important services. So if you were to break the public health missions essentially down into foundational and additional important services are those things that typically a community will fund. So I'll use it as an example, WIC. In some communities, public health does WIC. WIC can be done by somebody else, but if the community wants public health to do it and they fund that, then it becomes an additional important service for that community. A lot of your chronic disease prevention is additional important services because you're using folks like American Red Cross, not Red Cross, Lung Association and the Cancer Association. All those folks figure into additional important services. So foundational public health services. In 2019, we went to the legislature and got that written into state rule, so state law. Definitions, everything's in there. And then this last year, they finally funded it. It seemed unbelievable that public health wasn't being funded during a pandemic to do our foundational jobs. So the legislature came through, it kind of came through in a big way. In our current contract, we're looking at about $200,000, which is what we had anticipated for this year. And that $200,000 for FPHS covers a couple of things. It's working in our hepatitis C program, and our Hep C program we've rolled into the syringe exchange program. So we're meeting people out there who are IV drug users that typically have a tough time with Hep C. So we have that. Part of what FPHS can cover are the foundational capabilities like quality improvement, human resources, financial management, legal, those sorts of things. And the other $100,000 we're getting now is funding a new person in our finance crew to work with contract management, to work with grant management, and to work with foundational public health. So that's in our contract right now, $203,000, and that's we all have an accounting on that. We got notice that we're going to be receiving a large amount of FPHS money, and hold your hats because it's a big amount. $761,000 a year is what we'll be receiving, going up from the $203,000. So we met last week with Casey and Lydia and Dr. Gardner and Alex and myself to look at those things that are foundational and those things that we're not providing now. So as we get into this fall, and that actually hits our contract because it's not in the contract now, it will come in this fall sometime. We want to have a plan on how we're going to use those monies. It's difficult for us at this point because the money's coming in this fall in our contract and it's backdated for us to use from July 1st of this year. So we're not going to have an efficient use of that money because we can't spend what we don't have. And it's different than some of the contractual work that we do for DOH, and this comes as a cash payment out to us. A lot of the work we do, people think of as grants. We're funded in a number of ways. It's a kind of a kaleidoscope of funding. We have federal funding, we have state funding, local county funding, some fee for service. And of those fundings, we have grants. Some things are grants, but a lot of what we do are contracts. So we do work on a contract for the state. We're an arm of the state. We do their work for them. And a lot of the FPHS stuff is going to come through that. Some of this money is set aside specifically for environmental health. So we'll be looking at adding some folks, especially around solid waste and liquid waste work in environmental health. A good resource there. And then we'll be working with community health to see what those gaps are that we can work with in community health. Can we address things like HIV, something that we're just really not even touching right now? So what are those things that we haven't been doing, that we could be doing, that are foundational? Because not everything is foundational in public health. What are those things that we can fit inside those brackets and then and spend wisely on this money and really start making some improvements out there? Those are the big things coming this fall in funding. We still have a lot of funding available to us for the COVID response. So we're actually building Team COVID downstairs. We took one of our meeting rooms and we're converting it into desk space. We've gotten permission to go ahead and do some hiring to fill those slots. And I'll let Lydia talk about how that capability has helped her crew down there. But we're going to be building a little more robust COVID response and take some of the pressure off of our nurses that have been running this since day one. I mean, since February 28th of last year, we've had the same crew working this. So this will give us more capability and will let us get back to the work of public health. So the nurses, while they've been working on COVID, haven't been working in their normal programs, communicable disease, maternal child health. That gets us back into doing those contractual things that we need to be doing. So plenty of money on those aspects. We're expanding capability. And like I said, I'll let Lydia talk to that more in her piece. We are looking at vaccine planning going into the fall, and maybe Lydia would like to touch on this as well, as far as boosters and pediatric. And we have money to plan those activities. It's interesting that we get money from the state to plan them, but not money to actually do those events. So we have to go a different direction with that. And that's really in partnership with Mason General and with Peninsula Community Health Systems. So trying to keep it short today because we've got other things going. Are there questions on our funding models as we go forward into 2022?
Dave, this is Kevin. Just to be clear, will we be working on this a little bit more too when we have your budget workshop for next year?
Yeah, so a lot of this is going to wind up being a budget amendment, I think. You know,
Okay.
what we have right now in contract, we're going to run through the budget process with conversations with Jennifer and Frank, that we know this other funding is coming, and with the commission as well. We know the funding is on the horizon. It's just not in contract yet. I have received the new draft contract for the consolidated contract. So our consolidated contract comes out every 2 years. So right now, all I've got are the recitals and termination stuff. None of the funding pieces, none of the programming work is attached to this yet. So we'll run this through legal, and then once it's done, we'll send it back to the state, and then they'll attach all those other funding pieces to it, and we should be seeing that this fall.
And is your funding July through June, or is it, what's that?
Right. So typically anything we get from the state or the feds runs on the state fiscal year, which is July 1st through June 30.
Okay.
But, you know, the stuff we get from the county, we have the you know, a calendar year. So we actually wind up watching a couple fiscal calendars.
Gets a little confusing.
Yeah.
Okay, so anything else for Dave? Okay, we'll move on to Alex.
I will stop sharing.
Are you there, Alex?
Yeah, I'm here. Just
Thanks.
the screen's right. Okay. So good afternoon. Hope everybody's doing well. I have my updated EH report there for you. Not too much these past couple months going on in EH. I highlighted some code enforcement updates. I know we talked about that back in June. Are there any questions on my report before I move on to our sewage updates?
None for me.
Great. So I'm bringing back our Title 676 on-site sewage code amendments today. We briefed these back in July, if you recall. We drafted these updates back based on program feedback that we've collected over the last several years. If you remember these updates, this specific code chapter has not been updated since 2009. And we've worked with our on-site sewage advisory committee with it. The drafted updates were briefed again in July and then sent to the state for review. Department of Health got back to us and agreed with the proposed changes. They had a couple minor things, clarifying Washington State Department of Health on one thing, and then there was a sentence that needed to be reworded to be a little more, provide some more clarity on what we're trying to do there. But previous Title VI updates, appears to have gone through Board of Health and the Commission. So in addition, we're also required to hold that public hearing. So we're requesting the Board of Health kind of review this today, provide a final approval is what we're hoping for, and for us to continue processing this through the Commission with the hearing and ultimate approval and implementation in January. I can just answer some questions. I know this meeting, we're trying to get time limits here, so I won't go through every single one of these things, but I'll just open it up for questions and discussion. I can provide clarification on anything you guys need more information on.
I really appreciated your summary of changes, and it looks pretty good to me. I don't know if anybody else has questions for you, though. Any questions for Alex?
Good. So
Just
again,
a quick comment that I think it's, yeah, just a quick comment. Reading through it, it looks really good, and it helps to have the advisory committee too, doesn't it?
Yeah, certainly. There are industry professionals. We lean on them heavily, and yeah, it's nice to have a program and have that expertise involved and to run things through.
Well, I know this is not the final, but if nobody has questions, I would like to hear a motion to move it on to the county commissioners. Carrie, anyone? Darren?
I'm just trying to get unmuted. There we go. Yes, I'll make a motion that this be moved on to the county commissioner's plate.
I'll
Can I
second it.
Oh,
Oh, you're there, Kathy.
Yeah, I am.
Okay. So any other discussion? Hearing none. All those in favor?
Aye.
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 Any opposed? Okay, hearing none, it gets moved on to the Board of County Commissioners.
All
Anything
right,
else?
that's what we'll do.
Okay, thank you, Alex. Thank you for
Thank
all
you.
your work. So now we're to Lydia.
Hello, everybody. I'll get to my report in a second. So David mentioned the COVID team. So we are hiring a total of 5 people to take over the COVID work, especially we're in the, obviously in the rise right now, but we also have school starting, which has brought the whole new issue of school problems and teachers and closures of school, et cetera. So it's busy, lots of phone calls coming in as we expected and anticipated. So the team is consisting of, we have 2 on board right now. One of them is Cesar, who was one of our remote workers that has been working the past 18 months with us doing contact investigation and case investigation. And so it's great to have him on. He's also bilingual, does a lot of interpretation as well as translation for us. So we're real excited to have him. He's jumping on and learning Washington disease reporting system, and he's been on just a little over a week. So he's new. And then the next one is Jason Ritter, who came to us, and he is also working kind of replacing what Chris Nelson was doing a lot of the monitoring of updates from the state, from CDC, the governor's page. He's also working on, right now they're covering front office, which has been a good experience for them both since we're down on staff, but learning kind of what comes in, what kind of questions come in, and he's answering phones as well and working with the schools. So they're in training, they'll be in training for a while. There's a lot to learn, but so far so good, they're doing well. Next Monday, we have 2 clerical will be coming on to help assist us. We've backlogged in filing in just so many areas. And one of the clerical work strictly with the COVID team, helping do all of their work so they can stay abreast of what they need to do and do a lot of the paperwork, the copying, because there's so much stuff to be done. So I'm excited about that. They'll be on Monday, and then we're still waiting for a nurse. Actually, I don't know if we've even had an application in. I've been asking. We've had 2 inquiries that are both sounded good, but I don't know if they've actually got applications in yet. So hopefully we'll find a nurse soon. So that's our new COVID team that will be working. They'll be taking things over entirely. So the other staff, which basically is Elizabeth and Audrey right now, are still working it. Melissa jumps in to train here and there for the things that she was doing, but it's mainly Elizabeth and Audrey who need to get back. We're behind a year in our other communicable disease work, and the state's kind of wanting reports, but they understand everybody's in the same boat. So
Good luck finding a nurse. I hear everybody's looking for nurses right about now.
I know. I'm kind of hoping the Monday through Friday and no holidays and weekends will be attractive.
Well, after that mandate that came out, we'll see what we end up with, right?
Yeah.
Right.
So we've got testing sites now up through Curative in the north end, up the hub, and up by Mason General Hospital. That's working really well. They're open Monday through Friday, 8 to 2 p.m. And we're getting that up on the webpage. We changed our 599, which is still the kind of the COVID information line, and kind of added things on there so people could find that easy enough. And that seems to be working. It's cutting down some of the phone calls, which is desperately needed. We're starting to get information up on the boosters. People are already starting to get their boosters that fall into the category that can get them. And of course, people are calling, asking where they can get them. And so we're putting that up on the website as well. On my report.
I had a question
sorry.
on boosters, and I tried to get it clarified this morning at another meeting, and we're still looking at it. Pfizer's got the booster. What about the folks that took the Moderna?
Now, I read it quickly and I'll have to check it again, but I read somewhere that you can use one, so the Pfizer can be used for Moderna. And I read that. Obviously, Johnson & Johnson, there is no booster,
Right.
but that's what I read. And I don't even know what I was reading, but I went, oh, that's interesting. But they happen to know that they don't have the others. So.
Thank you.
Good question. So any other questions before I move on to something different than COVID? What we eat and breathe. Okay, so on my report, I just want to draw your attention to on page, I believe it's on page 5. Let me look. We talked about our substance use programs on 4 and 5. And I wanted to bring your attention to the COSAP program, which is what started all of our great work for behavioral health and substance use, the opioid crisis 4 years ago. It was a 3-year grant, but we got it extended for a year because of COVID. And it's coming to an end this month. It ends this week. We're really excited about all of the programs that have spun off of it. For the community. It's just every month there seems to be 2 or 3 more, whether it's through public health or in conjunction with other partners in the community, with the hospital and this. Sorry, I just blanked. North End.
Peninsula.
Peninsula. Thank you. I don't know why Peninsula just went. I could see the letters. Or our other our behavioral health partners in the community. Olympic Health and Recovery Services is one that has picked up many. So we're really excited about that. And I just wanted to just note that we are going to do a presentation, hopefully in November at the Board of Health, about everything that has spun off and all the wonderful projects and programs that are going on in the community now. And then down further on the last page, which is page 6, talks about the community health education assessment and data. Melissa Casey just completed our updated data for the community health assessment that we used to try to do every couple of years. We now have moved it to about every 3 years. And I was going to put that out to you, but it is kind of embargoed. And when we put things out through the normal manner with Board of Health, it can be pulled up by the public. And we don't want to do that because it's in draft mode and we're still working on it. So I am going to send it to all of you because we would love you all to comment on it and give us some input. It's gone out to Mason Matters Board. It has gone out to the Health Coalition members for them to all comment on it. And we've gotten some great feedback already on some other measures that we might want to add to it, some things that aren't clear, some detail that they want to see differently. So we're wanting the same from you. So you'll be getting that in an email, and then the instructions will tell you where you can email comments or questions back to Melissa Casey. So we're not going to release it really quick. We're going to go a couple of more months building it and making it really strong, because it's going to lead into the Community Health Coalition working on the Community Health Improvement Plan. And that will start out in the first of the year. And so we want to have some good data and some very clear things that the community wants. So I will be sending that out to you. I think that's it. Let me look and make sure I didn't miss anything. Nope, I think that's it. Are there any questions for me? Okay, thank you.
Okay, so we're on to other business and board discussion. Does anyone on the board have something they need to bring up? I don't see anybody unmuting. Okay. The next one is COVID update, but I think we've already had quite a bit of COVID update. And I don't think there's any public here. So can I get a motion to adjourn?
So moved.
Second?
I'll second that.
Okay, all those in favor?
Aye.
Okay, see you in 2 months.
Thanks, Peggy.